you by Clearview Hospital, of course. And I will be speaking with our guest today. I'm talking in person of Dr. Kunle Ajayi. He is a professional. Dr. Ajayi's core areas of interest include gynecology, endoscopy, and reproductive medicine, as well as the management of high-risk pregnancies.
When we say infertility, what we are trying to say is that there is an inability to achieve pregnancy after trying for about a year of living together. So it's not just 1 year of being married or 1 year of being boyfriend and girlfriend, but 1 year of having unprotected sexual intercourse, and not achieving pregnancy. So that's the simple definition.
Okay.
In lesser time, like 6 months for older women. So if I have an older woman, say she's about 35, who has been trying for 6 months, then that might be your trigger to start investigating, because you don't want to wait too long before investigating something. Once you've tried and it's not happening, then you need to get assessed, because it's not producing sperms, or maybe it's not producing enough. The ones it's producing are not moving. So, yeah, because it's possible that it could just be there could be sperms there, but they're probably just not moving, because you have to move through the vagina to the cervix, into the womb, and to the pelvis.
It might be.
For the female, it could be, it could be a problem with her. Maybe something in the womb preventing the sperms from moving up. It could be because she's not ovulating. Ovulation means, releasing an egg every month. What if she's not? It could be that there are some factors within the pelvis that just makes that place hostile for fertilization and implantation. So it could be male, female. And then if you look at it holistically, you find out that male and female contribute equally. The tubes are open, because those tubes are like the transport media for sperm and egg. Because without the tubes, the sperm and egg may not be able to unite. So we just do those basic tests to try to find out where exactly
the issue or the challenge may be coming.
And it's actually very, very easy. Most people, those are the basic tests. The answer is that for a couple that have combined male and female factor, you need to have some form of assisted reproduction. 6 years is a long time, yes. So assisted reproduction could be in the form of an IUI, which is intrauterine insemination, because that is one of the tubes is open. But the assumption is also that your sperm count is high enough to do an artificial insemination. But if it's not good enough, then your best option would be an IVF. There's no point wasting your time. The people will tell you a lot of things. We are going to boost it. We are going to flush this one. Most of the time, those things they just take your money. Like one of my colleagues will say, this is a Ponzi. So you need to be you need to be very clear, so you don't waste your time and your money. Yes.
Thank you so much, sir.
Thank you for calling. Like I said, your wife has had 2 previous myomectomies. That's fibroid surgeries, and the second one actually ended up with an infection that took time to heal. Yes. So the fibroids are back now, and you are considering having surgery again. I would suggest you don't.
Okay.
Because for her safety, because with infections like that, there is bound to be things called adhesions within the pelvis.
Okay.
Yes, and those adhesions might actually, make surgery more difficult. I'm sure it may make it more difficult and make it more dangerous for her.
Okay.
If she's going to have any surgery at all for her own well-being, then it will be one where where the uterus is taken out completely to avoid a recurrence. But I'm talking to you because you're anxious of pregnancy, and the truth is that there are solutions, and those solutions don't always have to be your wife. You understand?
Okay.
There are people that are capable of carrying pregnancy for you. I'm sure you've heard about surrogacy.
Yes, I'm aware, sir.
Yeah, so if the fibroid surgery is just for fertility purposes, I would say please avoid it because it might not be safe for her.
Okay.
Yes, sir.
Okay. All right.
But if she has very bad symptoms from the fibroids, then your best option will probably be to take out the uterus so that she won't keep having those symptoms.
Okay, sir. Okay,
Yes, sir.
sir.